borderline field, like in psychiatry is really interesting for that, to human sciences and the natural sciences. And I started working with drug addiction and people that were homeless, crack addicts, and also with women with problems with drugs. And then I started working in this subject of human rights and health. And that led me to Altamira, where they were just like building this huge dam that displaced a lot of people, expelled a lot of people from their homes. It changed dramatically their way of living. And I joined a group called Clínica de Cuidado. It was clinic of care. And we came here to listen to those people, and it was really interesting for me to understand how was their way of living, how it challenged our way of seeing things, everything like money-based, or everything can be interchangeable, and it's very different when you live in connection with nature. And so I just like fall in love with people here and all this knowledge, and I decided moving here, started working at the university, at the medical school. And after this, I started working with, I got this work with traditional communities to another level with this work together with Health in Harmony, to really do this connection with the environment, the social issues, and the health, for addressing the needs in health for these communities. It's not just health, not just the traditional healthcare the way we see that. And that's the work I'm doing here for the last year. And during COVID, it was really interesting experience, and I am sharing it with you today in a while. Thank you.
Great, thanks so much, Erika. Dr. Enrique Barros, could you introduce yourself?
Yeah, just unmuted. So I'm Enrique. I'm a family doctor in a rural community in the southern mountains of Brazil. And I just want to say how grateful I am to Health in Harmony for inviting me here and for being such good friends, especially John. Maybe he's looking, maybe he's watching. And it's been so cool, and I've learned a lot from you. And just to say that I learned from you in Edinburgh, and then we met again in Stanford, and I've been really learning a lot with you guys. So that's my basic presentation about myself. Oh, I must say that this bow tie, I just put it on because my little daughter said I should put it on. I actually had no courage because usually I see very good professors with it. So I couldn't do it, despite the fact that I am a professor as well. But since my little daughter said that, so I did put it on. So, yeah.
Well, we're thankful. It looks fabulous, and the feeling is mutual, Enrique. It's so great to see you on here, and you too, Erika. We really appreciate all you've been doing. And Dr. Walker, would you mind introducing yourself?
Thank you, Ashley, and thank you everyone for joining. First, I'd like to say that I'm not a healthcare professional, and so it's an honor to be sharing this panel today with these remarkable doctors doing outstanding work on the front lines of the COVID crisis. I am, however, an associate scientist and director of the carbon program at the Woodward Climate Research Center, located here in Massachusetts, just south of Boston. We were founded in 1985 as the Woods Hole Research Center. I've been at Woodwell for a little over 15 years, joining the institution as a postdoctoral fellow after receiving my PhD from the University of Michigan in Ann Arbor. I actually grew up in the forests of northern Michigan, and so I have spent most of my life playing in, living in, working in, thinking about and studying forests of various kinds, from the temperate zone to the tropics. I actually intended to study wildlife when I went to college, but I very quickly came to realize that trees stood still and they didn't bite, and so they were perfect for me as a subject of study. As a scientist, my research focuses on monitoring the status and trends of forests globally. In particular, I use field, aircraft, and satellite measurements to understand the contribution of forests to global storage of carbon and climate change at local to global scales. I began working with Amazon Indigenous groups back in 2009, providing training and capacity building on forests and climate, as well as applying these forest monitoring tools and techniques to better understand their forests through a lens of carbon dynamics and climate change. And it's about this work that I'll be sharing more with you in just a few moments.
Great, thank you so much, Wayne, and such a pleasure to have you on here. And thank you all. Just a little bit of housekeeping. Please engage with us. Use the chat down at the bottom of your screen. Ask questions. Comment on Enrique's fabulous bow tie, whatever it may be. We'll be tracking those, and we have some wonderful support in the background from our colleague Emma, who's going to help feed questions. So we'll have about 20 or 30 minutes at the end to be able to answer some of those questions. Dr. Barros might have to leave early. He's being pulled to another conference panel, so we'll keep you posted and follow up with any additional questions you may have for him if we're not able to get to them. Again, thank you all so much for joining us. So let's go ahead and get started. And Dr. Wayne Walker, if you could go ahead and kick us off.
All right, thank you, Ashley. I'm going to share my screen. All right, hopefully you are all able to see that.
We can see it great, yes, thank you.
All right, so thank you again, everyone, for joining our panel today. My role here is really to set the stage for my esteemed colleagues working on the front lines with communities in Brazil by providing a broad overview of the links between indigenous communities, tropical forests, and planetary health, with an emphasis on the Brazilian Amazon, particularly in the context of climate change. Before I do so, though, I'd like to say just a few words more about the Woodward Climate Research Center where I work. So at Woodward, we believe that achieving a safe and stable climate is the greatest challenge of our time. And this necessarily requires science-based policies and decision-making. At Woodward, we're organized around 5 scientific program areas, and it's these 5 programs that allow us to study the most consequential natural systems in a human context. And as mentioned, I'm the director of the carbon program, and if the carbon program has a guiding philosophy, it would be that any carbon stored on land is carbon that is not in the atmosphere. And so as a group, we work to identify strategies to reduce and ideally reverse carbon emissions from land. And so we refer within the community of scientists to these strategies as natural climate solutions. And this phrase, natural climate solutions, really came on the scene about 5 years ago. And as part of this growing body of research, it's been determined that where climate mitigation is concerned, particularly the climate mitigation needed by 2030 to keep in line with the Paris Agreement target of keeping temperatures below 2 degrees C, nature can provide a little more than a third of what we need in addition to reducing fossil fuels across 3 broad categories of protection, improved management, and restoration. And it's perhaps not surprising that forests, particularly forest protection and forest restoration, provide about half of this 37%. Now, of course, these interventions, which are so important to climate mitigation, don't happen on their own. They start with people, and what you're going to be hearing about more in this presentation, as well as the presentations of my colleagues, are about the role that people, particularly indigenous peoples and local communities, have to play. So coming back to forests, though, forests are so important to natural climate solutions because of, well, trees. It's trees in the forests of the world that remain the most effective tools we have for carbon capture and storage at scale. They're is currently no engineering solution, no technical quick fix to date that rivals what photosynthesis can provide. And so given the urgency of the problem, given what forests globally can offer, we need to be able to take advantage of them to their fullest potential. Despite decades of forest loss, it's remarkable forests still cover 31% of the Earth's land surface across the tropical, temperate, and boreal zones. And these forests in leaves, branches, trunks, and roots store some 450 billion tons of carbon. Just to put that into perspective, that's about 46 years worth of global fossil fuel emissions. Not terribly surprising, much of this carbon, about 3/4 of it, is stored in the tropics. And if you take a look at this map of current carbon storage circa 2019, you can see the densest regions of carbon storage shown here in yellow pop right out, and they are within the tropics. You can see the Amazon on the left, Central Africa in the center, and of course, Southeast Asia, particularly Indonesia on the right. So forests, tropical forests, are indeed special by any measure, but unfortunately, they are also especially threatened. Just this last year, 2020, some 40,000 square kilometers of primary tropical forest were lost to deforestation. That's an area the size of Switzerland. And it's important to appreciate, obviously 2020 was an unprecedented year for all of us in the context of COVID-19, the pandemic. Global GDP dropped about 5%. Emissions dropped 7%, yet deforestation rose about 12%. So a remarkable year, an unprecedented year on so many different fronts. But unfortunately, deforestation is not the only problem we face where forest loss is concerned. Forest degradation is also a growing threat and a rather insidious one. And it's an insidious one because whereas in the case of deforestation, the forest is cleared for some alternative land use, and it's rather easy to detect and track. Forest tends to be converted to agriculture in places like Brazil. But where degradation is concerned, the forest actually remains a forest by most traditional definitions, but the structural integrity, the ecosystem function, the carbon sequestration capacity is greatly diminished. So what's causing forest degradation? Well, there are a number of causes. Drought being first among them. Drought is driven by climate change, and obviously drought kills trees. Another cause is fire. Fire tends to be associated across the tropics with land clearing, and that certainly is the case in Brazil. And typically, adjacent forests, adjacent rainforests, almost by definition, won't carry fires very well. But as droughts have increased, particularly as we've seen over the last couple of years, the forest is cleared, the trees are piled, they're dried, and then they're ultimately burned. And what happens is those fires end up escaping into the adjacent forest, resulting in forest dieback and degradation. Edge effects are another cause. Edge effects effectively provide access to intact forest areas that wouldn't otherwise be there. The image at the bottom is a classic example of the beginnings of an edge effect. What you see here is a natural gas installation in a remote part of the northwestern Amazon. It's only accessible by remote airstrip, which you see in the lower left-hand corner. And that airstrip serves a series of roads that connects this larger natural gas infrastructure by a series of roads. And it's those roads that serve as the edges that provide access to the forest that ultimately can lead to degradation. Selective logging, of course, is another cause. Selective logging is essentially when people, typically illegal loggers, enter the forest, take out the highest value trees, leaving the lower value timber behind, degrading the ecosystem overall. And last but not least, there's hunting. We don't typically think of hunting as a degrading force, but what happens is when we remove mammals from the ecosystems, like tropical forest, mammals that are important seed dispersers, the overall diversity of the forest is reduced. And that leads, again, to overall ecosystem degradation. So under the best of circumstances, where forest carbon cycling is concerned, forests are tremendous sinks for carbon. But under the worst of circumstances, circumstances involving deforestation and forest degradation, forests end up being sources for carbon, no different really than fossil fuels. So obviously we need to limit scenes like we see on the right and try to maximize the opportunities that we have on the left. Now, I've talked a lot about forests and carbon storage and their role in climate stabilization, but it's important to appreciate, of course, that forests, particularly tropical forests, intact tropical forests, provide a suite of globally important yet vastly undervalued services that are critical to planetary health. These include maintenance of air and water quality, shelter for biodiversity. They provide food and fiber. They're obviously a source of medicines the world over. And last but not least, they sustain the culture and livelihoods of Indigenous peoples. And it's at the intersection of the culture and livelihoods of Indigenous peoples and forest protection and the climate mitigation capacity that they afford that much of my work involves, and the balance of this presentation is going to be about. So a few underappreciated facts about Indigenous peoples and local communities. They number some 370 million worldwide. They represent 15% of the world's poor. They occupy roughly a quarter of the Earth's land surface. Yet of all occupied forest lands, legal land tenure is held over less than 25%. Within the Brazilian Amazon, which you see a map of on the right-hand side of the screen, there are some 170 indigenous groups, some 380,000 people spread across some 600 indigenous territories and protected natural areas, shown here in light green and dark green, respectively. Now, if you just take a look at this map of the Brazilian Amazon, and sort of sum up the area of those light green and dark green areas in your head, you'll find that roughly 50% of the Brazilian Amazon is under some form of protection. Now, it's important to appreciate that this protection is not equal. There are different types of indigenous territories and protected natural areas. Never mind the fact that over the past several years, protection overall has declined, despite these labels that we like to talk about. But just to give you a sense for what protection can mean and does mean, I'd like you to focus here in the southeastern portion of the Brazilian Amazon, along what is referred to generally as the arc of deforestation. This is the Shingu Basin, one of the sites that you'll be hearing more about where Health and Harmony is working. I'd like you to focus on these light green areas, these indigenous territories. So this is the Shingu Basin circa 1984. And in light green, you see those indigenous territories. Shingu Indigenous Park is located in the upper part of the basin and the lower part of the screen. And the take-home point here is back in 1984, there was relatively limited deforestation. There's a bit, which you can see is sort of a splotchy, lighter checkerboard pattern around Shingu Indigenous Park, particularly to the east. But for the most part, what you're seeing in green here overall is intact forest. Now, fast forward to 2020, and this is what you see. A truly remarkable and staggering transformation brought on principally by conversion of land, deforestation, clearing of forest for cattle grazing, which you see on the left-hand side, which ultimately gives way oftentimes to soy production on the right. Now, equally as remarkable as the deforestation is, it's also remarkable the role that you can clearly see that the presence of these territories and the people within them have played in buffering against this onslaught of deforestation. So in my own research over the last decade, I've been interested really in two questions, which I've answered from different angles over the years. The first is simply how much carbon is stored in indigenous territories and other protected lands occupied by communities? And secondarily, what role have these communities played in buffering these lands against forest loss and in maintaining forest carbon storage over time? So quantitatively describing what you qualitatively saw in that previous image. That's what a portion of my work has focused on. So what have we found? Well, several studies have been conducted by myself and colleagues. The most recent one is in review by Pruitt et al., spanning the period 2003 to 2019. The map shows forest carbon loss over that period. During this period, Brazil's own deforestation monitoring system reported 186,000 square kilometers of forest loss. Just for context, that's an area the size of Uruguay, Brazil's neighbor to the south. When we combine that deforested area with the degradation and disturbance that I talked about earlier, we see that some 11 billion tons of CO2 were emitted during this period. Just to put that in context, that's about 2 years worth of fossil fuel emissions from the United States. Now, what's remarkable about this loss, that of the total, of that 11 billion tons, only about 8% of that originated from indigenous territories. And of that 8%, the vast majority, 75%, was as a result of the degradation factors that I described earlier. Only 25% was due to deforestation. So they have remarkable impact where maintaining forests are concerned and in turn maintaining forest carbon stocks are concerned. So let's talk about some more recent trends in Brazil. Obviously, we all know that in January, the Bolsonaro administration came into power. From 2020, going back to 2012, which was the low point of deforestation and emissions in the Brazilian Amazon, there's been a 143% increase in carbon emissions due to deforestation. But over just the last 2 years from the Bolsonaro administration, we've seen a 47% increase. And you can see the largest jump over that larger period was between 2018 and the beginning of the Bolsonaro administration in 2019. Now, it's important to appreciate that the losses in 2019 and 2020, 90% of those have been from illegal activities. So just 10% of those losses are technically of a legal sort. Now, you don't have to follow the news very closely in Brazil or quite frankly, anywhere else to see headlines like this. How Bolsonaro has left Brazil's indigenous people vulnerable in the pandemic. Bolsonaro seeks to open Brazil's indigenous land to mining. COVID-19 and Amazon fires choke the lungs of Brazilians and the planet. The Amazon is on fire. Indigenous rights can help put it out. Now, this rhetoric and the associated policies, of course, not surprisingly, have consequences. And I'd like to share the results of a couple of studies that were just released this past month in March by environmental NGOs, colleagues of ours, partners of ours working in Brazil, ISA and PHAM. Okay. So some findings. Indigenous lands continue in 2019 and 2020 to be among the land categories with the least deforestation and fire. Less than 5% of the deforestation and less than 8% of the fires occurred in indigenous lands during this period. However, indigenous lands improperly registered as private property rose some 55% between 2016 and 2020. To 3.6 million hectares. Of the 330 properties that were surveyed, this was happening. This voluntary registration of properties illegally was happening in 275 of those 330 properties, so 83%. And a clear relationship was found to exist between these illegally claimed lands and illegal mining, deforestation, and fire in these indigenous territories. Now, not surprisingly, land invasions threaten health and safety. Along with malaria and other infectious diseases, COVID-19 is spread directly, for example, from gold miners to community members, resulting in 949 cases in the Yanomami indigenous lands as of October 2020. This is just an example from the ISA report of what one of these illegal gold mines looks like. It's an absolute eyesore on the landscape. And I highly recommend this report. It's very interesting. So 2020, the current year, we're only 3 months into it, but what are the trends? Well, in January and February, deforestation was relatively quiet. However, unfortunately, in March, this past month, it's picked up such that 368 square kilometers were lost. This ends up being more than either March of 2020 or March of 2019. So we hope that trend doesn't continue. On the positive side, fires are down. It's thought that it's a bit wetter in Brazil this year as compared to the last 2 years. We'll see what the future holds for fires as the season progresses. In summary then, there is no vaccine, unfortunately, to stop the pandemic of tropical forest loss. However, much like with COVID-19 itself, there are a range of actions that can be taken to reduce the risk and to keep Amazon forest intact. Across Brazil, there's a number of things that can be done. First and foremost, promoting agricultural intensification so that additional lands don't need to be cleared for cattle grazing and soy production. Illegal land grabbing needs to be combated. Disputed lands need to be designated and protected. This ends up being a source of a great deal of deforestation. There also needs to be efforts to incentivize forest protection on private lands, as well as restoring lands that have been degraded. Now, with indigenous lands themselves, firstly, and perhaps most importantly, rights to land and livelihoods need to be guaranteed. Enhanced border enforcement is needed in restoration of the rule of law. There needs to be greater investment in healthcare and education and alternative livelihoods. And finally, and perhaps most importantly, the people themselves need to be involved in community-determined solutions. And it's actually these last 2 points that my colleagues are going to be talking about in much greater depth in subsequent presentations here soon. So with that, I look forward myself to hearing from them. Thank you again for joining, and I'm going to turn the floor back over to Ashley. Thank you.
Great, thanks so much, Wayne. Really appreciate it. Really wonderful to hear about this research and in many ways, so much of what we already know, but also just important to have this validated. So Dr. Erica Pellegrino, I'd love to turn it over to you for your presentation.
Okay, so let me just share my so here. Okay. So it's really good to talk after Wayne giving us this amazing background on how deforestation and climate change is happening here in the Amazon. So I will talk a little bit about our approach here in Brazil, in this this area in the Shingu Basin that he mentioned. So we know that Brazil is doing bad in the COVID response. We have 398,185 COVID deaths. I didn't want to round the number because each one of them matter. More than 1,000 of them are indigenous people. And we have like this 210 million population, which gives us a rate much bigger than the world rate, even though with the India recent rise in COVID cases, like 12.7% of all COVID deaths that happened in the world were here in Brazil, and we only have 2.6 of the world population. So we have a death rate 6 times higher than the rest of the world. We have, like Wayne said, we are living this disaster with the Bolsonaro government, and we are facing the biggest climate crisis in history. This loss of Amazon rainforest and the COVID crisis, they are intimately related, and I think it's important to remember that this is something that's being done deliberately. The institutional strategy to spread the virus, which is something that some really serious researchers carried on all the legislation and all the actions and non-actions that Bolsonaro government took to deal with the pandemic. They intentionally spread the virus and lead the country into chaos. And this happened at the same time as our environmental minister called in a meeting to push through what here in Brazil he said passar a boiada, push through the environmental regulation using the pandemic as a shield, because people would be distracted by COVID. And this is happening. This is happening as the data Wayne showed us. And so the picture from the same region that he showed before, showing the illegal mining in indigenous territories in Brazil, and also the fires that happened in 2019 here in one of the most devastated lands near here. And this increase of deforestation that's been happening, as he showed us. So I will not repeat what he already told us. And here is one map of the deforestation around here. So like Wayne said, over 90% of all the deforestation is illegal. And the government is working to make it legal in some ways, with regulation for mining and for land grabbing. And also the last week, the environmental secretary, minister, he just fired one of the federal police that was persecuting people that was doing illegal logging. He was doing his job and he was fired for doing his job. It's just crazy. And we will see, like in the next slide, how the areas that are more vulnerable to the deforestation in one hand, and for other illegal activities in other hand, they overlap with people, with the more vulnerable areas to COVID. So this is one map of susceptible areas among indigenous territories. It does not include all the protected areas, including the riverine, but the indigenous lands, and it was based on difficult to access to healthcare and the remoteness of the areas. Also the pressures that they've been suffering from illegal activities as mining. And here is the map of deforestation. So we can see that for this area of the arc of deforestation, the more vulnerable areas, they overlap. And more in north, we can see near the border, the other areas that are not with this higher rate of deforestation. They are areas that have issues with illegal mining and remoteness. So the COVID pandemics shows us how very clearly, as in those maps and in the government actions, how the problems, they come together. And so I would like to think a little bit how it can lead us to solutions, how this thinking in a crisis and acting in a crisis, and we are living this crisis that includes climate crisis, health crisis, and social crisis, socio-economic crisis, and how the way we live is leading to those problems, and the solutions, they can be led by the traditional communities. So this is one quote from Ailton Krenak, an indigenous thinker here in Brazil, that to go back to normal would be like convert to negationism and accept the earth is flat. And I will just add this other quote from him, from the same indigenous thinker, about the pandemic in this book, Life is Not Useful. And he says, if we want, after this pandemic, to reconfigure the world with the same matrix, it is clear that what we are experiencing is a crisis in the sense of error. But if we see that we are undergoing a transformation, we will need to admit that our collective dream of the world and the insertion of humanity in the biosphere will have to happen differently. We can inhabit this planet, but it must be in another way. Otherwise, it would be as if someone wanted to go to the peak of Himalayas, but intended to take their home, the refrigerator, the dog, the parrot, the bicycle. With such luggage, he will never arrive. It will suddenly become clear that we need to change equipment. And surprise, the equipment we need to be in the biosphere is exactly our body. And it's interesting because he goes through this very interesting book about how the body of indigenous people is settled to make connections with nature and not living separately of it, as something that he says is an invention that people called mankind or something. It's something made up. So how can we think about solutions with, and why those solutions comes from indigenous communities? We have this very acknowledged role from indigenous communities to where we have indigenous people living in the protected areas, we have these territories being actually protected. They are forest advocates, and they want to live in balance with their environment. It's their way of living. And so we have this very important role, and it's a role that's being done for a very long time. So this is something very important to remember, that the Amazon rainforest is not a natural occurrence as the way we usually think that in the Western way of thinking what is nature and what's human-made, because we have this hyperdominance of some few edible species that are the staple food and of the communities, the indigenous people, and they've been planting the Amazon forest. It's a legacy from the indigenous communities to the whole world, being a pump of water to make all the climate of the world bearable, and also this huge biodiversity pool that can have us the next medicines and the solutions that we need. And it's 1,000-word knowledge accumulation of those people, and they have to be acknowledged for that. So that's why we do this radical listening proposal in Health in Harmony, which Ashley will speak better later. We asked the communities during this COVID outbreak, what do they need as a thank you from the world for protecting this forest, for protecting their environment, for living in harmony, and to protect themselves from the COVID pandemic as well. We usually, these radical listening sessions would be done like in groups and round groups to listen to people, but because of COVID, we needed to do it by radio. And we got like as many as 70 people, everyone in their houses with their radio to talk about what they needed each time we did a session. It was really interesting. And they told us they needed healthcare professionals. They had a lot of trouble to get health outreach because of the remoteness of the areas. So just for you have an idea, Altamira is the size of the whole country of Portugal. So it's huge. And it's difficult for people to get to the doctors, and they also wanted to have access when they are in the territory, so they don't need to get into town. And during the COVID pandemic, this was even more important because of the risk of being infected. Emergency evacuation, transportation, support for exams, surgery, water treatment. And they also asked for better solutions for forest economy and food security, education. They want to have doctors and nurses from the communities in the wild so they can take care of their health themselves, and also value the traditional knowledge and medicine. So we started this work just as soon as we could. We did medical visits in the territory, health consultations, and also we bring vaccines. It was like last year, so it was not COVID vaccines, but general vaccines. We just did almost 900 vaccinations because a lot of vaccines were delayed in the communities, and also the regular ones. Dental visits, so a lot of people were having like almost 1 year without going to the city to see a dentist, and they had pain. And more the numbers, we have like a lot of stories of people that had opportunity to have a better control of diabetes, hypertension, that got their case better see to come into town when it was needed to go to a surgery, for instance, in some cases that was needed. And we are doing this longitudinal follow-up with those communities. So this is something important too. They complain that sometimes a doctor gets there, and the next year or next 2 years, another doctor goes there, and it's all from scratch. So this integrality and longitudinality of the work is something that we are doing. And we also installed Wi-Fi points in the communities, hired more nurses to stay in the communities in more points, so they wouldn't have to travel so long to get to a nurse. And the telemedicine is also for emergencies that arrive with the nurses, so we can guide them to better medical proceedings and medication. We are improving the evacuation capacity when there's need to get someone in town. So recently we had a baby that came here through plane, and someone that we are doing that in a way that's more quickly and more accurately with the needs, the medical needs for the communities. And this is very important for them to stay at home and be protected during the COVID crisis. And this also comes together with this food security, like not only food, but also tools for them to make their own, like fishing or hunting or growing food themselves. So it's all community planned. It's not some just generical food distribution. Ensuring this communication strategy, advocacy, and we did this together with a campaign in the city, the Brief Shingu campaign, which was very important because people circulate. They live in remote areas, but sometimes they have to come to the bank and see someone from their families in the city. And protecting people in the city is also protecting people from the forest and so on. And we also are very high rates of COVID here. And we need to do a lot of advocacy to get more restrictive measures. So it's something that we've done as well. And it prevented, we are very sure that it prevented deaths because the rates decreased. We had like full UCIs and it's now in a better shape. It's not good, but it's better. So that's in a glance, it's what we've been doing. This just resuming like how crisis can help us see the problems clearer and how to think of the solutions with the communities and how they are answering their own problems and they have answered to our problems in the global community as well. This is an example of this Think Global, Act Local strategy. And I think the planetary health approach is something natural for indigenous people. For them, it's very straightforward to do these connections and to understand why protecting their lands, it's good for their health, and for the world health as well. Working faster in this crisis with local partners, so we don't have to do it from zero. We have a lot of partners working with those communities, and I think this is really important, not think that you are the only one there. And so we are working together with the public health system, with ISA that works with production, with the university, and so on. And so that's, I think that's the final message, being allies to forest people and meeting their needs as a thank you for the world for everything they've been doing. So these are some nice pictures from our expeditions. And that's it, what I had to share with you. Thank you.
Great. Thanks so much, Dr. Pellegrino. It's incredible to just hear practical, real-life planetary health approaches to addressing the climate and nature crisis. Enrique, I'd love to hand it over to you to share your insights, perspectives, and experience in dealing with COVID during this pandemic.
Okay, thanks, Ashley. Very, very interesting theoretic approach to forests and climate change and planetary health from Wayne. Thanks a lot, Wayne. I learned a lot. And the detailed approach in the people on the ground by Health and Harmony and Erica is awesome and very inspiring to me. And I hope you understand that those two presentations will have direct implications to what I do. And so I'm going to start now by saying that I am grateful. I think that one of the secrets of being satisfied in this life is to recognize and be grateful. And I want to be grateful again for Health and Harmony. And I must say for Planet Earth or Pachamama or Mãe Terra or Gaia. So this is really what I'm doing here. So just being grateful and living it. So my presentation is going to be about two stories. So the first story is about my clinic and my community. And the second story is going to be about the Imbi. I'm not sure how to pronounce it actually. Mimbia. So my wife, the professor that has the connections there, is correcting me. So Mimbia Guarani, which is a group that lives in Porto Alegre, where my community is located at. So in the metropolitan area. So if you imagine Latin America more or less like a heart, okay, and you separate the eastern part of it, my town would be sort of down here, and this would be Uruguay, sort of more or less. Okay. Now I just want to show a picture of where I live. So let's see if I can do it. So this is you shouldn't see this, but I'm always lost with these slides. Okay, let's see if I think I'm gonna need to call my wife again. Tati, me ajuda aqui. Sorry, guys. So this is what happens when you have gray hair. You just can't deal with the... Tá aqui o slide, ó. Como é que eu puxo ele? Ah, so, okay. So, are you seeing my slides or not? Actually, yes?
We can see
Okay.
them, yeah. Great.
Yeah, so let me just, so this is, I think it's an important picture. Let me just do this. So can you actually see that there's a lot of green here, there's a lot of forest. And my line of work is how to put planetary health into the clinical practice, especially of family doctors, especially in the health strategy in Brazil, which is the main program of the national health system, which is responsible for, I would say, over 100 million people just in Brazil. Yes. So I live in southern Brazil, and this is our little town. It's under 6,000 people and a lot of forests. So I really understand how we're connected to forests. So I'm gonna shut this down now, and let's see. Okay. So back to my sorry, my face again. So the story is I've lived there for 11 years, and I learned about working with patients, and actually learning that it's not the university that really makes me a doctor. It's really my patients. So they decided that I am their doctor, and this is why I feel that I am a family doctor. And living for 11 years in the same community, then you start feeling like a true family and community doctor, right? So I know my community like the palm of my hand. And now talking a little bit about COVID. COVID was really catastrophic. It's a pandemia. It's a global pandemia, of course, and it's really a syndemic in Brazil, clearly a syndemic. And I just want to say that I completely support Erika in her point of view that it's I wasn't going to be that clear, Erika, but it is deliberate. It is genocide, what is happening. Well, I just lost another friend who was my age, a healthy guy. And there was no need for that. That was completely preventable. So it's a long conversation. I think that Erika was very happy to show the document that was produced, evidence-based on publications by Bolsonaro's team. And it was collected by a very prestigious university from São Paulo. So it's quite clear to us. There's no mistake here. So I actually had long COVID. So it was terrible. I almost had to go to the hospital, but fortunately I didn't need oxygen. But it took me 2 months to start getting better. So this is a very serious disease, and of course it impacts. I have a little fly or a bug here. That's what happens when you're in the forest. So this is a subtropical forest, yeah, a hotspot for biodiversity. So the community was highly impacted. We have a lot of deaths now from a second wave. and maybe we have the variant already, it's hard to say, but it disrupted all our lives. So I think that being on the ground, being on the front lines, I guess I see a lot of successes, but I see a lot of failures. And the successes I see is how our public, universal, and free access system was a huge success. It wasn't a success, it was a huge success. If we compare it to the United States, a lot of the problems that people had there was that there wasn't handy access to healthcare. Well, it was enormously facilitated by this public health system, which is really what Health in Harmony has proven with that, with one of the articles. I actually think that Erica didn't show that one. It's a quite recent one, showing that when you offer very high quality healthcare, you actually lower deforestation. So our public health system should actually do that, but it has a lot of problems. And right now, the major problems are the government officials, which are deliberately sabotaging the work we do. So that's the first story, okay? So because of this, I was in burnout. I was in burnout. It's a long story, and to make it short, so we are now in pandementia. That's the term, pandementia in Brazil, meaning that people are just, it's not confusion, it is way beyond that. So it's pandementia, and I was overburdened. I had to get out a little bit and go to the woods. I told my friends at Health in Harmony already. They tried to contact me, and that was a bit of an upsetting thing because I had hard connections, internet connections. So a friend of mine told me, look, you must look for signs of God. You might be surprised. And this is, he was quoting from Pope Francis. Well, I'm going to tell you now the second story, which starts with my wife again. She's a professor at the Federal University from my state. We call it URGS. And she took me to meet the chief of a local tribe of Mibia Guarani next to Porto Alegre. And he was just such a gentle and kind and inspirational and spiritualized. He's not actually elder, but it feels like he's very elder. Maybe because they've sort of continued their traditions and history for thousands of years in this region. So it feels like they're older than they look, in wisdom, I mean. And so my wife is studying how to help teachers and health professionals to go and help them deal with, yeah, in a respectful manner. How should they go into these lands owned or inhabited by these indigenous peoples? So she was interested in their conception of health. And what I learned from him and what I felt, it was more feeling than actually hearing, was that time is very of the essence. And when you are with them, he said, listen, if you come here, you need to respect us. You need to observe. Don't make silly questions. And just take your time. So that was just awesome. Coming from the the civilized in quotes, because in Brazil we're not civilized. Let's make it clear. It's not civilization, not the project of civilization at least. And we're actually going the opposite way. But the Western way, the clock, it doesn't work for that time, for the health time, for the planetary health time. So this is very important to me. So his grandma is ill because their land has been invaded. That's 10 days ago. So it's a very recent story. I was there yesterday. So their land was invaded, and they set a part of the forest on fire. And these invaders built houses for it's different than in the Amazon, because this is a microcosm compared to the Amazon macrocosm. So they built houses there and they built fences. I asked him, listen, I have to talk tomorrow. It's a big international meeting. Can I present this and ask for international help? Because of course this affects Porto Alegre and their health, but it's very symbolic for Brazil, and it's very symbolic for the world now. It's very symbolic for Brazil because Porto Alegre plays a very large role in the politics and determining the lines of politics in Brazil. Of course, São Paulo plays a much larger role, but Porto Alegre helps mainstream Bolsonaro's politics. So we need to reverse that. And one way to do that would be to recognize this humanitarian crisis, which it is to me. And so this is really a story of love, wisdom, and interconnection within nature, of rupture and destruction. So what are the lessons for the planetary health movement? Maybe we should say what are not the lessons, because here I think everything we've talked about are the lessons. But I would look to the drivers behind all these things, which may be one of the drivers might be time, how we deal with time in the clock society. Yes, so it's always faster and faster and faster. Maybe if you saw Copenhagen short movie a couple of days ago, and you felt the same impact. It was a very fast video, so that you get this feeling of a crazy clock society that needs to slow down, otherwise you're going to kill the earth. And what are the interconnections with COVID? Air pollution, forest fires, climate change, planetary health. So we need to look at the drivers again. And so I wanted to mention that air pollution kills about 7 to 9 million people around the world per year. So of course, COVID is terrible, but in crude numbers, it's not comparable to air pollution in terms of number of deaths per year. So along the years, it won't be comparable. It's just orders of magnitude over the deaths that we have from COVID. And of course, forest fires are a major cause of air pollution. And this is why Erica was pointing that out. Actually, we're just coming out with a report on the effects of forest fires on health. So you may want to look to that. So it's endorsed by our Working Party on the Environment, which I'm currently chairing. And so again, look for the drivers. Well, so COVID is a crisis, but sometimes in crisis we see opportunities. So we have this Healthy Recovery call, which was endorsed by over 40 million health professionals. That's right, 40 million health professionals. Of course, their representatives signed it, and it was done in cooperation with the World Health Organization, and it was presented formally to G20, that is the presidents of the largest 20 economies, national economies in the world. A very pragmatic call saying that when we're talking about recovering from the economic losses because of COVID, we need to make sure that the science ministers and the health ministers are on the table with the president and the economy minister, so that we make a synergy between economy, or we can call it regenerative economy for planetary health. So I wanted to bring that up front. Ashley asked me to talk about a little, some WONCA calls, that is the World Organization of Family Doctors. And I'm chairing the working party on the environment, as I just said before. So we have two important calls, Ashley. So the first one is the Planetary Health Call for Family Doctors. And it was then aligned with a call for all clinicians to act on planetary health. It's published on The Lancet. And the second one that is just coming out now, if you want to check that out, you can go to the website of WONCA, WONCA, which is our acronym for the World Organization of Family Doctors. It's a call to action for all countries for COP26 in Glasgow, the meeting of all nations about climate change. And we're basically saying that all national colleges of family medicine should recognize that we are in a climate emergency and that we should act accordingly. So I think I can end my presentation on that note. So grateful again, yeah?
Thanks so much, Enrique. We are grateful for you, for the reminders, for ourselves individually, for all of us collectively, for our leaders. And so thanks for bringing us back to Earth. Thanks for bringing us back to the forest. And most importantly, thanks for your work. We really appreciate it. So I just want to give a quick overview of our work at Health and Harmony and what that's looked like over the past year during COVID. And what a planetary health response to the pandemic has looked like for us. And then leave some time to get to your questions. There's been some really brilliant questions in here, so thanks so much all. Keep them coming. So when the pandemic hit over a year ago now, we were in the process of growing our programs, replicating our model in new rainforests and countries. And because our teams here in the US and internationally had worked in humanitarian crises in the past, we realized that COVID-19 was something we had never seen before. Not only that, it was going to be absolutely devastating, particularly for the communities that we work alongside, who we knew already lacked access to high quality healthcare and basic resources, but we also know that there was a distinct and continues to be connection between their well-being, access to healthcare, and degradation of the rainforest. So as an organization, we quickly transitioned into an emergency infectious disease response. We focused on equipping frontline staff, strengthening local health systems, supporting resources and tools, and doing everything we could to prevent the spread of COVID-19. So that was over a year ago we started this. And just to say, with every wave, we continue that cycle, and we are all very much still in it. And in the same breath, we can appreciate the deep, deep inequality and injustice we see in the response to COVID-19 and the availability or lack thereof of resources to save lives. And we have to acknowledge that colonization and racism have very, very far-reaching and deep systems of oppression and inequality that are very much at play in this process. And the harrowing situation in India that we're seeing unfold in this moment is just the latest case in point. And we can see cases rising again in Indonesia, in Brazil, Madagascar, and many other countries. So we believe that COVID-19 is the emergency within the emergency. It's the first of many climate shocks, we believe, and unless we reverse these anthropocentric pressures on the forest and its people, as well as the critical biodiversity, we'll soon hit a collective tipping point. So where do we start? We believe we have a bright spot in this challenge that we're all facing, and that is to do something simple, to listen. We call this methodology radical listening because it is radical to stop, slow down, and listen to people. And as Erica told you, we ask communities, you're the guardians of these precious forests that the whole world benefits from. So what do you need to live in balance with these forests as a thank you for your stewardship and protection of them? And what communities do is they design these brilliant, sector agnostic, highly interconnected solutions that focus on human and environmental health, and we continue to receive the benefits of that. From there, we then invest in the highest quality resources to be able to support these community designed interventions. And communities, again, have just expressed consistent interconnection between degradation and access to healthcare. In Indonesia, this looks like cutting down trees to pay for health emergency. In Brazil, this looks like people needing to leave their land, leaving it vulnerable to encroachment, land grabbing, et cetera, to be able to access high quality healthcare in urban centers. So we were lucky to have a team of researchers at Stanford University, as Enrique was sharing, research this and look at, does this work? And we were one of 6 data sets out of over 12,000 that had solid data showing a win-win solution, that when you listen to communities, when you invest in their solutions, you get over a 12-fold return on that investment in above ground carbon alone, not even accounting for the human health impact, biodiversity, below ground carbon, hydric cycling, et cetera. So we know it works. We're now working with those researchers to look at resilience. We believe these communities are more resilient to climate shocks like COVID-19. Our hypothesis is that due to the integrity and regrowth of the forest, they're more healthy, they're more food resilient as people transition into things like organic farming. And again, they have better medical access. So as Wayne was saying, we've seen a 12% increase in logging, which is a major contributor to the massive spike in CO2 emissions and loss of biodiversity. Cutting and burning the forest accounts for over 78% of all land-based greenhouse gas emissions. And these are moments when we need to be trending down. We know the IPCC has told us we have only 10 years, we're in year 9. So we have a lot of work to do collectively. So a planetary health approach to the COVID-19 pandemic in Indonesia, Madagascar, and Brazil, and our experience couldn't just be focused on an infectious disease response. We also had to bail out the rainforest, and we had to focus on saving forests while at the same time our frontline staff were saving people. So I just wanted to share a little bit with you about what that looks like. In Indonesia, the medical center, doctors, nurses, et cetera, worked in system strengthening, public health outreach and education, but they also developed a stimulus package for the rainforest. And so, at a time when G20 countries were spending nearly 54% of their stimulus investments in the energy sector, over $190 billion to bail out coal, oil, gas, and airlines, Alam Sehat Lestari around a rainforest in Indonesia was bailing out the forest by setting up nurseries in the backyards of former loggers, business owners, and people who were cut off from their distribution networks, struggling economically, and then buying those seedlings to reforest the rainforest. They were buying food from farmers to be able to feed and support the most vulnerable in these communities, and all doing this at a time when so many of our colleagues in conservation were stalled, weren't sure what to do, because oftentimes conservation doesn't acknowledge the human health component. In Madagascar, this looked like communities designing food resilience programs, training in agriculture, SRI rice, and doing this ahead of cyclone season, ahead of their lean season, so that they would be healthier, more food resilient as the second waves of COVID are getting underway now. And as Erica said, in Brazil, communities design brilliant interventions, telemedicine, bringing in boats, as you see down here in the lower left-hand corner, of mobile clinics, dentists, building out healthcare infrastructure so that people could stay on their land so that it wouldn't become vulnerable at a time when, as Wayne showed you and Erica, there were major increases in degradation. So this model has caught the attention of an organization that seeks to prevent the next pandemic. It's called Preventing Pandemics at the Source. And this coalition understands that the world is rightly focused on developing and distributing vaccines and managing the economic fallout of COVID-19 and bolstering health systems to manage the crisis. But we also have to address the root causes, and as Enrique was saying, of pandemics that will arise in the future as we continue to encroach on our natural world. So it's simple. Listen to Indigenous, traditional, and rainforest communities. They know the solutions to reverse deforestation, to improve planetary health, and to even prevent the next pandemic. We should invest in their solutions, and we should absolutely invest in their other ways of knowing. So with that, I would love to see if we can get to a few of your questions. So let me go ahead and bring those up. And just a special thanks to our panelists. Thanks so much to our participants who have been listening and sharing questions. So I would like to start with Erica and Enrique. And this is really a question about your dreams. You know, what is your dream for the communities that you work with and serve, you know, in this time of COVID, but also for the future? If you could share with us a little bit about your perspective and hopes and what you'd like to see for them.
I will answer, but I think Enrique left to the other panel.
Okay, thanks so much.
So I think my dream for those communities is that they are able to live their lives the way they've been used to. So like Enrique said very well in his presentation, in this space of time that is not this accelerated one, someone that this philosopher Boaventura de Souza Santos, he called like monoculture of time. It's the monocultures that we spread in a lot of ways in Western communities, in Western humanity and civilization, and it's not the way that people live. So I hope they can be happy living in the way they use it to, and I think that's it. And health is part of it, and it's an honor to be part of helping them achieving that.
Great, thanks so much. And we have a question from Rafael for both you and Wayne, Erica. How do we talk to people that don't connect with this concept of Mother Earth and deeper ways of knowing our interconnection between people and planet? How do we connect with them regarding the narrative on planetary health? Wayne, why don't we start with you, and then Erica, if you want to jump in.
Well, I think first it actually starts with the sort of approach based on listening that you as Health and Harmony very much espouse, and I very much support, which is first, rather than telling, rather than preaching, about what people should be doing, about what the problems are, it needs to start more with a basic understanding of what is driving people's decision making, what is driving people's priorities to for example, deforest or illegal log or illegal mine or whatever the destructive activities might be. I'm sure in many cases we find that their priorities are their families, they're providing for their loved ones and so on and so forth. They're economic, they're social, and once we can understand where they're coming from, then we can begin to reach them and try to find some common ground about what these broader problems are, what the implications are for what it is that they're doing, and try to reach some solutions.
Great, thank you. Erica, your thoughts on the question?
I think it's a really good question because it's really hard to make people listen sometimes. And sometimes they just don't want to, so there's nothing, it can't be helped. That's something like we are in a crisis and we are facing challenges, and we will have to let some things go because the world can't handle it. And I think there are some people that just don't understand that with the deep that they should, and sometimes it's just a matter of understanding. I think the young activists in Europe, like Greta Thunberg, does that in a wonderful way, like showing people our house is on fire, how are we not doing anything about it? And I think Ailton Krenak, the indigenous thinker that I shared, he does the same. He says like the word is you say that the sky is falling and the best thing you can do is change our refrigerator model. It can't be that. So I think sometimes it's interesting. He also says like the younger generation could say something like, so now that it's our turn, the part is over. You're saying that I can't travel that much because of the carbon footprint. I can't have produced all this kind of trash and so on. So I think it's important to have data and to inspire people with these other ways of thinking and living the world, and try to address all the unhappiness that is in this way of living life that we are trying to change.
That's great. And I appreciate you both kind of continuing to make it practical. It takes all of us in our individual lives and collectively as well. Wayne, I have a question for you from our friend Marcelo, and he's wondering, are there any correlations between carbon stock and other environmental services from forests, so eco or environmental services? Can you speak more to that?
Absolutely, absolutely. And it's perhaps not carbon stock directly, but the presence of the forest itself, rather than necessarily the amount of carbon that is correlated with, for example, rainfall. Many studies have shown the impact of deforestation, for example, on rainfall, not only locally in places like Brazil and in the agricultural regions, but also at some distance away. So there's local weather, and then there's larger regional scale patterns of weather and climate. There's certainly temperature regulation. We've all stepped inside of a forest, out from the open, and experienced the cooling effect of being under the forest canopy. And so forests are like air conditioners, again, at local scales and at larger scales. They have a tremendous cooling effect. And so there's absolutely a correlation between the presence of forests and of course the carbon they store and temperature. And the third one that comes to mind is I would say erosion control. Obviously, particularly where you have tropical forests in more diverse, elevated landscapes, when you have deforestation, then the next thing you have tends to be erosion, and erosion results in pollutions of streams and rivers and so on and so forth. So there's a tremendous amount of correlation between a lot of these different services.
Great, thanks so much. And my last question is for you, Erika, before we wrap up here. I wish we could get to all these brilliant questions. We'd love to follow up with you. And again, thanks so much for everyone for joining, to our wonderful panelists, Dr. Wayne Walker, Dr. Erika Pellegrino, and Dr. Enrique Barros, for your work, everything you're doing. And Erika, lastly, a question from Monica. What's the most important lesson we can learn from the leadership of Indigenous communities when fighting for environmental justice in our own communities?
I think the most valuable lesson is understanding that it's all connected, that fighting for our small changes in our daily life, it's important for the bigger picture, and also making like advocacy and asking for, like, you are in US, but you can pressure your congressman to not making deal with Bolsonaro if you know what's happening in Brazil. You can, we can as a world community bring responsibility for what is happening. So I think this is something that the indigenous leaderships, when they are protecting our land, they do. It's not only their land, it's everybody's land, and they understand that as interconnectable, like understanding that the sky will fall. It's something that it's over the whole world. It's not only over this specific land. And they've already, like, just for the with the colonial process and the way they left, they lost their way of living, the way they saw the world first. They've already seen the end of the world. So we have some lessons to learn with them. How can we deal with this end of the world scenario?
Yeah, and how do we hopefully change course? Well, thanks again, everyone. Emma's dropped in the chat ways that you can stay connected with us, support the work of Indigenous, traditional, and rainforest communities. And we look forward to seeing you all in other presentations throughout the week at the Planetary Health Annual Meeting. Special thanks. Please take good care and be well.